Hello and good evening, everyone. I am Dr. Aman Khera. I'm co-founder K for Parents, and thank you all for joining in today to this very important topic of discussion regarding cancer prevention and early diagnosis. When last week, when we were actually planning the topic for discussion, when I proposed that let's talk about cancer prevention, a lot of feedback I got from my colleagues and few doctors was that we should not be talking about this. And the reason that was is that, the word cancer is a very negative word. It's a dark word. The word cancer comes with a feeling of fear. The word
Kaka,
cancer
Kaka.
comes with a feeling of sadness, suffering, pain, and eventually end of life. But why we decided to go ahead with this topic was that we want to clear the fact that this is not so. Cancer need not mean that there will be a lot of suffering. Cancer need not mean that that is the end of life. In last about 2 decades, about 15, 20 years, even today and going forward, a lot of researches and developments are taking place now. A lot of new medicines have been developed. A lot of with the help of technology, a lot of new machines are coming up now. Where about the outcome of cancers is becoming very favorable to the patients. By what I mean by that is that the quality of life and the longevity is improving. But a very, very important factor that comes, for having a better quality or a better outcome of cancer is the early diagnosis. So what I mean by that is that if we are able to diagnose a cancer early, the outcome is going to be much better. It is very well known today that many cancers, not all, but many cancers, if they're diagnosed early, they can be cured. You can the people, the patients can be cured of that. So that is a very, very important thing. But for that, we have to know that how is it going to how can we early detect a cancer? Of course, there's a very important role of the doctors, the clinicians, the laboratories, which help in early diagnosis of a cancer. But the onus and the lot of responsibility lies on the individual himself or herself. It is the individual who should be knowing that what are the common symptoms, what can be the warning signs, what what signs or symptoms if you develop should trigger an alarm that look, I should better get myself checked for a cancer, because the initiation has to come from the individual himself. Secondly, today in India, the burden of cancer is increasing. India today is, amongst all other countries in the world, India has a very, very high share of cancer. The disease burden is very high. And if I tell you a statistic that it is estimated that 1 in 10 people are going to be suffering from cancer in India. And that's a very, very huge number. I have said in my previous webinars also that whenever a disease is very, very common in any society, what happens is that lot of myths, lot of what we call false facts, they float around. And unfortunately, people fall in the trap of the myths. They fall prey to the myths, and eventually, what happens is that they do not get the right kind of treatment done, or probably they ignore the symptoms, and eventually the potentially curable condition becomes incurable. So we have to be very, very careful about that. So today, to discuss about how we can detect a cancer early, how we can we prevent it, what are the myths, and to answer your questions also, we have invited Dr. Kanika Sood. Dr. Kanika Sood is a senior consultant. She's a cancer specialist associated with Dharamshila Narayana Superspeciality hospitals. It is one of the largest and I should say the oldest hospitals of East Delhi, very well established. Dr. Kanika has the experience of more than 15 years as a cancer specialist. And we have invited her today. And today, actually, she had a very busy schedule. She had to attend another conference, and she cut that short and came over here. Thank you so much, Dr. Kanika, for joining us today. And I'm sure that she will throw a lot of light on how we can detect cancers early, as well as what are the myths which are in the society that we should be careful about. Thank you, Dr. Kanika, for joining in today.
Thank you for having me there with you. I'm glad to be, serving the purpose of prevention. Thank you so much.
So let us, today, let's start the discussion with, first understanding that what are the common type of cancers, few of them in both males and females that are, I mean, the most common type of cancer that can occur. So that once we know that these are the common type of cancers, we would be, going further and understanding that how we can prevent them. Dr. Kanika.
So first of all, see, cancer can happen in any organ in the body. First of all, one should be knowing the fact that cancer can develop even from skin. But there are certain cancers which are more prevalent, more common in our country. If we talk of men, the most common cancers in our men are head and neck cancers, oral cavity, mouth, throat, then lung cancers. Then the elderly are getting more of prostate cancers and colon cancers. These are common cancers in the men. Whereas in women, the number one, the commonest cancer here these days is the breast cancer, which is followed by the cervix cancer. But women in our country are also getting oral cancers because there is a prevalence of tobacco chewing in our country. Few cancers are very unique to our country. The Western world does not have it. These are the oral cavity cancers because it happens because of the chewed gutka tobacco. And the second common cancer, which is again more in our country, is gallbladder cancer. So these are few cancers, I think, which are very, very common in our country, and one should be knowing about them so that you can apprise yourself and understand and get timely treatment if somebody is really suffering from them.
So this is very important because once we know what can happen, then only we will be able to look for it. We'll be able to see that if that is developing or not. So that's very rightly said. Quite a few cancers are very prevalent, like you said, gallbladder cancer and about the colonic cancer, the cancer in the breast, in the cervix, in the females, the prostate, oral cavity cancer. Today, if you all know that government is very, very particular in advertising it even on the pack of cigarettes and in the near the tobacco shops that this can cause cancer. So this is very, very important and very, very common in India today. So going forward, now once we have highlighted that what are the common cancers, let's pick up a few common cancers. What should be the the warning signs? Because we are not doctors. I mean the public is not a doctor. So what should be the warning sign? Common things that should raise an alarm in the mind that look, there's something wrong. Let's go and get ourselves checked. Let's go and get ourselves screened for cancer.
I think this is a very, very important question which you have brought up, and I was very impressed that you had highlighted in your introductory talk also that we should know those alarms. Our body always gives us signs. What happens is, for example, we are having headache. So our body is telling us something, but what we do is we address the headache. We take a painkiller, but we will not address the cause. So it is important that whenever we have any symptoms, we should establish why is it happening. For example, for cancer, if I can, give you a very small set of signs and symptoms which you should be aware of, I can abbreviate it in a word called caution. So remember the caution word, and I will expand it for you so that you can put it somewhere and remember. C stands for change in bowel bladder habits. That means if you have been having a very normal digestion every day morning, you are able to go to the washroom, clear your bowels, you are swallowing your food normally, there are no digestion issues, the things are in place. But if suddenly you start to have constipation alternating with diarrhea, or there is a severe constipation for which the medicines are not working, then that's something which raises an alarm that this is not a normal indigestion. We need to get it evaluated. For A, you will remember it as a sore which does not heal. So sore can be muh mein chala hai, zakham, which you have been seeing that there is something in the mouth or any part of your body, but it is not healing. So any ulcer or any sore which is not healing, you have taken 5-10 days of medicine. Despite that, you may be a diabetic also. Sometimes people presume that we are diabetics, that's why it's not healing. But you have to show to a doctor to just exclude that it is not a cancer. From you will remember any bleeding coming from any part of your body, be it nose, mouth, anal canal, or vagina, any place. If there is a bleeding, it is a warning sign. So that at times people might have bleeding if they are on blood thinners, because quite a lot of our elderly people, because of risk of strokes and CVAs, are on blood thinners. So don't get false alarms. But if there is a bleeding for which you are unable to find a cause, it can also be indicative of something which is going wrong in the body, which can be as worse as a cancer. Then the next word is T. T represents thickening or lump. So any part of your body, if you appreciate any guilty, gant, sujan, any thickening that is new in onset, it was never there, and suddenly you started noticing that there is a lumpiness in the body, that has to be elaborated. Here again, I would want to clarify. Many a times, you have certain small lumps in your arms, thighs, or back, which you might be having from childhood or your younger years. That can sometimes be any other condition like lipoma or neurofibromatosis. So don't fear. In case you appreciate that there is a lump, go to the doctor, show it by touch of it, by the feel of it, and by its location and its history. The doctor will let you know whether any further tests have to be done. But any swelling which is new in onset, even if it is not painful, because many a times what happens, people think dard nahi ho raha hai, so cancer nahi hai. So it is not true. Many a times, there will be lumps which not be painful to start with, but slowly and slowly, when you ignore them, then you may start appreciating pains. Then is indigestion. Indigestion, it is like you having bloating. Gallbladder cancer, इसलिए देर से पता चलता है because people ignore symptoms. You are having bloating, indigestion, which is going on and on. You are taking antacids, you are taking medicines. Despite that, this indigestion is persisting. This is a very, very important symptom to look for, because ovary cancer and gallbladder cancer sometimes might just present with symptoms of indigestion. So indigestion also has to be addressed. Then O stands for obvious change in wart or mole. आपके body में कहीं पे तिल है, मस्सा है, you have any birthmark or any mole, you should see that if it is increasing in size, it is changing in its shape, it is becoming irregular, or it is bleeding, or उसके ऊपर कोई ulcer बन गया, that is something which is needed to be shown to a doctor, because it is changing in its dimension as well as its shape. And last but not the least is nagging cough. So cough can be a sign and symptom of throat cancers, lung cancers, disseminated malignancy to the lung. So if any cough, it is long standing and you have shown and you are not able to find a solution to it, then at the back of mind, there should be a thought that we would want to exclude cancer as well. So I think this would cover most of the symptoms, except additionally, I would want to add for prostate, if you are having certain urinary symptoms which are in form of you have to repeatedly go to the toilet at night, your urine stream is not forming, then this is something which can be indicative of a maybe some enlargement of the prostate, which can be cancerous also.
Dr. Kanika, you have so nicely put it up in one particular word. What should be the warning sign, that I think in one word you have given the whole summary of the webinar that what we are going to discuss. So this is really interesting. I think what Dr. Kanika has said is very right. Basically, the summary is that if there is a deviation from your normal system, anything, could be your bowels, could be your going to toilet habits, could be your dietary habits, could be sometimes you're having abnormal bleeding, anything when there's a deviation from the normal, which we have to realize, and we are the ones who will come to know it first, nobody else will come to know it first. So अगर हमें लगता है कि हमारे normal system से हम कुछ change हो गया है, if you are having some bleeding or if there's a growth, like what she said in the last, that is the कोई तिल है या मस्सा है जो ग्रो कर गया है, so that is a very very important, that should ring an alarm that there is something wrong. Let's go and get ourselves checked up for this. Now, a lot of people come and say that how do I know that am I going to develop cancer? Am I more prone to it? So what are the predisposing factors, or let's say high risk factors कह सकते हैं कि some people may be prone to develop a cancer, some may not be prone to develop a cancer. So can you please throw some light on that?
Absolutely. I think first of all, most of us think we are immune to cancer. We all live in a world where we say, हमें कुछ नहीं होगा, because in our family nobody has cancer, we will not have cancer. हमने तो कभी कुछ खाया पिया नहीं खराब, हमें cancer नहीं होगा. So I think first and the foremost we have to get away from this belief that हमें cancer नहीं होगा, because cancer can happen to anyone. To be very precise, in everybody's body, sometimes there are cells which become abnormal and they become cancer. But God has gifted us with certain, checkposts in our body. There are some checkposts where our body itself is policing itself. So those 2, 3, 4, 5 cancer cells which are being formed, they are destroyed. But some people who are unfortunate, where their immune checkpoints, are not very alert, there these cells start to grow and go to other parts of the body. So anybody can get cancer, first of all, but by risk, as you said, which would be the high risk people, we divide people into average risk and high risk. So for risk point of view, we first and the foremost see that what is the age of a person. 60% of cancers happen after 60 years of age. So as we grow old, our chances of developing cancer increase for two reasons. First of all, over our lifetime, we have received so much of exposure to many agents, chemicals, pollution, cosmic radiation. So all these are slowly and slowly accumulating in our body. And so there is ample time for these diseases to manifest. Secondly, as we start to grow old, there are degenerative changes also happening in our body. So added to the lifetime of cumulative exposure to certain agents and these degenerative changes, elderly are more predisposed to cancer. Second factor is people who use tobacco and alcohol. Tobacco is responsible for almost 1/3 of the cancers. तो हमारे देश में हर साल 14.5 लाख लोगों को कैंसर होता है. उनमें से ऑलमोस्ट 4.25 लाख लोग जो होते हैं वो तंबाकू की वजह से कैंसर लेते हैं. एंड दिस मे बी ईदर cigarette, it can be bidi, it can be hookah, it can be canny, or any chewed tobacco. But sometimes people say, no, which form of tobacco I'm taking is safe. And it is not only the person who is smoking, even the family members who are receiving the second-hand smoke, they also get inhalation of tobacco and cancer ho sakta hai. And in tobacco, in cigarette, we have 7,000 chemicals, hydrocarbons. Of those 7,000, 7 are 100% class 1 carcinogens. That means 7 चीजें बीड़ी सिगरेट में ऐसी हैं जिससे कैंसर होता ही है. It is just that it may not get opportunity to develop in some people and the others manifest, but tobacco is one of the big risk factors. Alcohol consumption independently and even in conjunction with tobacco can cause cancer. So alcohol in itself it is an irritant. So it can cause cancers of the throat, of the food pipe, but along with tobacco, it can act in synergy. तो दोनों बिल्कुल एक दूसरे का सहयोग देते हैं और they can increase the risk of developing cancer. Then certain viruses are also responsible for cancer. So if there are people who have not received vaccination for hepatitis, have suffered with hepatitis B and C, they are at risk of developing certain cancers of the liver. If the women have not been vaccinated, the girls have not been vaccinated for human papilloma virus, then again there is a risk of a cancer which is called the HPV-induced cervical cancer, oral cavity cancer, or anal cancer. So infections long-standing, जब वो body को irritate करती हैं, that can also manifest as cancer. And then is a very important factor, that is our lifestyle. Our diet and lifestyle, I think that is the most important thing in our hand, is responsible for almost 40% of cancers. If we are not eating diet properly, and a proper diet, somebody had asked the question also, what to eat so that cancer na ho. So if your diet is improper, and by improper diet, I mean a diet which is full of processed carbohydrates, full of fatty food, full and lacking fiber, lacking roughage, lacking fruits and vegetables is the one which predisposes you to cancer. And added to it, if you're taking a lot of spicy food which is irritating your mouth, there is consuming food at a very hot temperature can irritate the food pipe. All these factors are also responsible for cancer. Then lifestyle also includes how much you exercise. आपका जो पेट का मोटापा है वो नुकसानदायक है. It is known that if your body mass index is high and you have truncal obesity, पेट का मोटापा है, then you are at higher risk of developing cancer of prostate, colon cancer, endometrial cancer and breast cancer also. And साथ ही कुछ और बीमारियां भी साथ आ सकती हैं, like hypertension, diabetes, because truncal fat में जो insulin की metabolism है वो derange हो जाती है. And all these in our country we call it metabolic. So these predispose us to lifestyle cancer. So if we take care of our diet and if we are taking care of our body weight, we are regularly exercising, I think 40% cancer को हम होने से ही रोक सकते हैं, वो नहीं होंगे. Then there is also an impact of your profession. For example, if you are working in certain industries जहाँ पे chemicals को exposure है, जैसे there are people working in the dye industry, they are working in industries with leather where they are working. So they may inhale certain fumes, they may be inhaling asbestos workers, people working in limestone industries, mines, they can get cancer because of prolonged exposure of certain carcinogens. Then last but not the least, there is a genetic association also. Although लोगों को लगता है कि कैंसर तभी होता है अगर परिवार में किसी को कैंसर हो, but to be statistically very clear, it is only 2% of cancers which are genetic. तो अगर 100 लोगों को कैंसर होता है, उनमें से केवल 2 अनुवांशिक होते हैं. केवल 2 लोगों को कैंसर इसलिए हुआ है बिकॉज उनकी जीन्स में कुछ ऐसे म्यूटेशंस आए हैं जिससे कैंसर हो सकता है. So the common cancers which can be genetic include breast cancer. There is some incidence in breast cancer and prostate cancer as well. Ovarian cancer. So these are a common set of cancers जो कुछ परिवारों में ज्यादा होते हैं who have certain mutations. I would not elaborate on those details, but that also indicates. Stress of late has also been recognized that a person who is very stressed, there are high level of cortisol in the body. There also, the risks of developing any lifestyle or a degenerative disease is higher. So I think this is just a summary of the risk factors which I can put it up. So all those people who are harboring all these, they are consuming these tobacco, chewing tobacco, consuming alcohol, are not exercising, are obese, are at a higher risk. So these are the people who need to be much more alert about their health and more cautious in terms of the symptoms if they develop any.
I think you have said very rightly, because you have covered almost all the possible risk factors. But yes, what I can understand, which I would like to repeat, is that the tobacco chewing, the smoking component is very, very harmful, because it, along with various other diseases, because smoking does not cause just cancer, it causes a lot of other diseases also in the body. But it's one of the very important and the leading cause of cancers in India, not only in India, all over the world actually, as a matter of fact. And yes, time and again we have emphasized that lifestyle is a very, very important, important thing that we have to keep in our mind for so many diseases like diabetes, high blood pressure, and other diseases. And cancer is also now one of them, where, like what Dr. Kanika has said, that if you are obese, there's a possibility of developing cancer. Frankly, I never knew about that. But that is also something which should everyone should be alert about and take care about. So I hope everyone is clear on this. And if anyone has anything to ask, you can please ask. Gupta ji, you have raised your hand. Do you want to ask anything?
Yes, please. First of all, thank you, Dr. Raman and Dr. Kanika, for taking this topic today, which is very, very important and very, very scary for everybody. In fact, I have heard all these that causes or symptoms and how we can treat cancer by early detection. The point which I want to highlight is that, say, in my own family, I have seen 6-7 cases of cancer so closely, and whatever may be the reason, but the detection is the main cause, that the detection of cancer is so late when there is no treatment possible. We go for surgery, chemotherapy, radiotherapy. We spend money, people have been spending money. In spite of all that, still the patient could not be saved. Problem is, yes, there are 1 or 2 cases which I have come through in my family also. If detection is done early, the patient could be saved. But the problem is that when we go to a doctor, the treatment is given basically on a temporary basis. Okay, you have a headache or you have stomach pain, you have ulcer, etc. And by the time they realize that we should go for a test, it becomes too late. So like in my own family, there are cases of 2 brain cancers, 2 cases of blood cancer. I mean, when it was detected, they say already it is 4th stage or 3rd stage. And they gave a life expectancy, whatever. And we, of course, we took all the treatment, surgery, everything, but still the patient could not be saved. So this early detection, I mean, the possibility of early detection, basically, I think in India, it is still at a very premature stage that it is not detected early. So what is the basic reason that why the doctor, the medical profession in India cannot have some sort of test when it can be detected early? And if it can be detected early, I'm sure the treatment is possible.
Gupta ji, you have said a very, very important thing, very rightly said. And as a matter of fact, frankly telling you, that was going to be my next question. That is there a way, I mean, we do not have symptoms. Let's say a person does not have symptoms, but should he or she get himself or herself screened? And if yes, how?
So I think Mr. Gupta has really beautifully put those words which we hear in our OPD day in and day out. Doctor, हम तो जाते थे, हम तो जा रहे थे, पर हमें किसी ने बताया ही नहीं. So I think I will take this question in 2 parts. First of all is that why wait for symptoms? Why should we wait for symptoms to appear? Where we have lacked and the West has really come forward in finding a solution is screening. So screening क्या होता है? Screening का मतलब है if somebody is not unwell, person does not have any symptoms, he's absolutely hale and hearty, but he goes to the hospital and checks himself for hidden diseases, right? Investigation होता है कि जब आपको दिक्कतें आ गई, then you start to find out that now what is the cause for these symptoms. So let's not wait for investigations. The first and the foremost thing India needs is a screening. And we are all very complacent. Even if I ask 100 doctors who all have gone for screening, I think 5 or 6 people will raise hands. So first of all, it has to be mandated. It has to be compulsory. Just like West, what they do? In the insurance, you will not get your next year's enrollment unless you give the results of your screening. So similar things have to be done in our country also, so that everybody first of all goes for screening. So now I'll elaborate what actually the screening means. So in screening, when you meet the doctor, he will first see what is your lifestyle, what is your age, family में क्या बीमारियां चल रही हैं. Based on that, he will mention a set of tests which you should go. For example, if a woman comes to me who is 45 years of age, maybe there is no family history, so still because of her age, and we know after 40 breast cancer is common, we will ask her to go for a mammography, a pap smear. So these are tests which can pick up disease very early and even at times 10 years before disease has even started to occur. For example, like मैंने एक test कहा pap smear. So it is picking up cells in the stage when it is pre-cancer. Cancer 8 साल बाद बनेगा, 10 साल बाद बनेगा, but you picked it up so early that you did not let it develop into a cancer. So I think there was a beautiful, saying when we were children, a stitch in time saves 9. तो अगर हम बिल्कुल समय पर छोटी चीज को पकड़ लेते हैं तो हम बहुत सारी चीजें बचा लेते हैं. जैसे गुप्ता जी ने कहा that even no amount of money could save those loved ones of his because things were advanced. So as the disease progresses, our number of treatments become unlimited, the expenses increase, and the outcome is poor. So for the outcome to be better, it is timely to do. And it's a Hindustan Times snippet I read that 70% of people in our country come in a stage when disease is incurable. And almost 60% of people in our country, when they are diagnosed with cancer, they die within the first year. And the reason is we see mainly patients coming to us in stage 3. So stage 3 तक पहुंचने ही नहीं देना है, screening के लिए जाना है. So for screening, for example, if there's a male, we will do some oral screening to look for any precancerous changes like leukoplakia, erythroplakia. If gentleman is elderly, we also order a PSA test, which is something which is done for prostate cancer. Examine करके देखेंगे, महिला है तो breast examine कर लेंगे, cervical gynae examination कर लेंगे. So we can pick up things in advance. So first and foremost is screening. Coming to the second part of it, that why people ignore symptoms. So what happens? Even non-cancer symptoms are like cancer symptoms. Cancer के जो पहचान चिन्ह है वो बिल्कुल अलग नहीं है. It never can differentiate at upfront. But if your doctor prescribed you some medicine for 4-5 days and it is still not working, that should raise alarm. So do not just sit over it कि भाई डॉक्टर ने दवाई दी काम नहीं करी अब चलो छोड़ दो दवाई काम नहीं करी. छोड़ना नहीं है. You have to be more pressing and go again that see doctor, the medicines did not work. I think we should move forward. So that is how you should be, moving ahead with your life, because many a times you may not go back to that doctor again. उन्होंने दवाई लिखी but आपको some relief नहीं मिला, आपने ही किसी दूसरे डॉक्टर की ट्राई की कि इनकी तो काम नहीं करी. So don't jumble here and there. Go and ask for further investigation.
So Gupta ji, what Dr. has said is very right. You see, initiative has to come from the person himself. And this is for everybody. And that is what we as care for parents, we keep on telling our customers, our members, that go for a checkup. Even if you have no problem, go for a checkup. And हमें क्या reply मिलता है? हम अभी ठीक हैं, हमें भी जरूरत नहीं है. This is a fact. Like what Dr. Kanika said, that we are not so, we are very complacent about it. हमको लगता है कुछ नहीं होने वाला, ठीक है? हम बाद में देख लेंगे, हमें जब प्रॉब्लम होगी तब जाएंगे. But that is not so. We should set up a protocol and we should go and check up. Even if we are feeling perfectly fine, a regular checkup is very important. So people should go for an ultrasound abdomen to be done so that to see कि कुछ अंदर develop तो नहीं हो रहा. After about age of 50, I think at least once in 5 years, we should do a colonoscopy should be done to see endoscopy that whether any development is happening or not. So on so forth. There are many tests that are available. Which the screening for ladies, Pap smear is very very important. I think once in 3 years or 5 years, we should be doing Pap smear. So that to rule out any, like what Dr. has said, any pre-malignant or pre-cancerous situation तो नहीं है. तो ये हमें अपने आप हमें उठ के चलना है, हमें अपने आप चलना है और जाके ये इन्वेस्टिगेशन और टेस्ट कराने हैं. गाइड करने के लिए डॉक्टर्स बैठे हैं. We are sitting there for you. We can guide you what is to be done, but eventually you have to go and get these tests done for yourself or your family members.
Doctor Saab, I mean, yes, you have rightly said so. But at the same time, sir, my experience has been like, okay, it is maybe true for most of the people. Like even if you go for tests, etc., regular checking, I mean, the right, detection is not possible in many types of cancers. Like say, okay, for breast cancer or prostate cancer, which are treatable, which are basically can be cured completely. There are certain, like say for brain cancer or blood cancer. I mean, it is very, very, I don't know, the way we have experienced, we were going for regular checkups for those, for my brothers, my sister, my, nephew, etc. But they were having headaches or somebody was having some bleeding somewhere, but they were being treated in a normal way. And by that time, when the disease became so worse and the tests were done, then we found, no, it's already in 3rd stage or 4th stage. I mean, the doctors, if they could have recommended some tests before, if it could have been detected early, the things could have been changed. But yes, some certain cancers like breast cancer or prostate cancer, which are curable, like even for the stomach, for this thing also is food pipe, etc. Like I know my elder brother, he had a food pipe cancer. They cut short it, they did this thing, and for the last 20-25 years, he's still okay. But there are certain cancers, like especially, I don't know, maybe the blood cancer or brain cancer, there are no symptoms. I mean, the patient, a normal person cannot feel anything. Like my wife is having headache for last like so many years, and we have been going to so many doctors, but her headache is still continuing. You have got the MRI, etc. But you never know. I mean, when at the last day somebody can say, "Oh, this is something like this."
Gupta ji, that's where, the nature takes
Yes.
over the humanity. That's where we, we as doctors and even as humans, we have to surrender somewhere. But yes, what you're saying is right. But no doubt, the requirement of regular checkup is there. Rudra Singh ji, you have also raised your hand. Do you want to ask anything?
So I had a point for Gupta ji that because he is giving a very elaborate history that quite a lot of family members are afflicted. So herein comes the role of genetic molecular oncologist. I think
Okay.
as a family with so many people coming, getting brain tumors and all these cancers, you should meet a molecular oncologist, and I am sure Dr. Kira will help you out with that, where the molecular oncologist will sit and draw a pedigree of your entire family. He will see किस side के में किसको क्या क्या बीमारी हुई, and in that situation they will advise the rest of the family also. See, you are worried जिनका हो गया, but what about the family members who are there? So
Yes.
what are those set of tests that the other families should be doing to take care? See, you can't go back and reverse things, but the other family members will have to do a more intensive screening. अब वो average risk नहीं रहे. From risk point of view, they are the people at high risk. So the screening policy of high risk is very strict. So then you have to be more and more stringent. And definitely I agree to your point. मैं भी बहुत बार ऐसे पेशेंट देखती हूँ जो रेक्टल कैंसर कहते हैं कि डॉक्टर साहब हमें तो पाइल्स का इलाज करते रहे, हम तो आते थे. Because symptoms sometimes mimic like many other diseases. So yes, medicine does have some share of ambiguity, but let's not be very pessimistic. Let's at least make an effort to, do screening, which is the ultimate tool in our hand as of now.
Yeah, thank you very much, Dr. Kanika. Yes, I appreciate this comment. Yeah.
Going forward, as I had said in my initial message, that when a disease is very common, there are a lot of myths that remain in the society. So, Dr. Kanika, can you give us some? Because this is very important. Because people, if they fall in the trap, then they can get deflected and do not come for the right kind of treatment. So, like some people say that excess of sugar can cause cancer, artificial sweetness can cause cancer. Can you please throw some light on what are the more, because you deal with patients every day, what are the most common myths that you come across?
So, see, I would say that there are few things which are scientifically proven, but by the time they reach to the public, the format changes. The message changes. So it is said that sugar causes cancer. No, sugar does not cause cancer, but tumor cells are fond of sugar, right? When we are doing PET CT scan, we tag the agents to the sugar molecule, and so the tumor cells preferably take them. So people who are affected with cancer, we tell them to take sugar in moderation, but we never can say that sugar causes cancer. Sugar does not cause cancer, but who are cancer patients, there are studies telling that ketogenic diet helps because tumor cells को आप starve करते हो. So it is a totally different story which has been labeled as a myth that tumor होता ही sugar खाने से. So it is not true in that context. Second thing is, all artificial sweeteners do not cause cancer. There is a artificial sweetener which has aspartame. So aspartame containing sugar sweeteners have found to cause more cancers of the urinary bag, which we call the urinary bladder. So urinary bladder tumors increase with aspartame sugar intake, but there are many other diseases, cardiac diseases, which have also been linked to artificial sweeteners. So you have to choose your sweeteners very judiciously. So, जो sucrose based हैं, for example, I will put the brand, I will not hesitate in sharing the brand like Natura, Splenda. These you see they are sucralose based. But जो artificial based होते हैं, stevia is again something which is something from a natural source. It's a sucrose. They do not have known linkages to causes of diseases or cancers as of now. So पहली चीज to choose the sugar sweetener judiciously. Second thing is don't overdo anything. Excess of anything is bad. So whatever you are taking should be in moderation. Do not, take sachets and sachets of these artificial sweeteners. So these two things, I think, are something which of relevance in this context.
One thing which is a matter of debate, not once, many times, which I have, experienced, and I'm sure you must have also experienced, is people come and say that, herbal medicines can, treat cancers. And my so and so relative was having cancer, and we were giving herbal medicines. Can you throw some light on that?
So I think this is one of the things which we see in our OPD day in and day out. I would say when I was training as a student, I remember I'll give an incident. I think that will clarify things better. I remember a young woman in her 30s coming with breast cancer, and she was in a phase of denial कि मुझे नहीं हो सकता and मुझे नहीं कराना, अंग्रेजी इलाज नहीं कराना, and they went to some hermit and they said that we will go for an alternative treatment. She came walking to our hospital that time. And after 6 months, she was brought on a stretcher. The entire tumor had burst and it was all hanging out like a cauliflower. And then also she was in a disbelief. She's like, "Bimari andar se bahar nikal." So we see such disasters. So please do not, get under the impression of these miraculous magical treatments, because we have never seen miraculous results by any alternative medicines. Alternative medicines, yes, Ministry of Ayush is conducting a full-fledged scientific trial in AIMS, where they are seeing that how do these alternative medicines, help the allopathic medicine in improving cure rates. They cannot independently cure tumors, but the tolerance to treatment can get better by usage of certain herbs, and there's a full-fledged, national study going on it. So many times I see people who have been on Ayurvedic and homeopathic, when they come to us, they are low in platelet, because these medicines also have some agents. The chemotherapy drugs भी plant से आते हैं. Paclitaxel, which is a chemo drug, it comes from the bark of a tree. So many times it might happen that there may be some active agent in these medicines as well. So we will never know, because we never know the components of natural medicine. So how it is working with our medicines is unknown. It may be synergistic, it may be antagonistic. So rather than self-medicating, it is always better you disclose to the doctor that you are on some alternative, so that they can give you a go ahead or stop. Because magical cure, so far, neither me nor any of my colleagues have ever seen a magical cure. There are anecdotal cases. Sometimes there are certain lymphomas जो ऐसे भी self-resolving होते हैं. So then, people come with high claims that, जादुई इलाज हो गया. So please do not fall in traps to such things, because we as oncologists, day in and day out, see that people exhaust their money in these alternative medicine, and then they come back to us when we actually cannot do anything for them.
If I would just like to add to what Dr. Kanika ji just said, based on my personal experience, I fully agree. Basically, one should not depend upon all these tall claims of these Ayurvedic treatments for that we treat all sorts of cancer, etc. We should not, and none of us should fall prey to all these things. This is my personal experience. 50 years ago, my eldest sister got blood cancer. She started believing in these sort of treatments, and she spent a lot of time in that, and that wasn't the case, basically. So you can take some treatment as a preventive from homeopathy or Ayurvedic, but please don't depend upon these treatments on these things. This is my personal experience.
No, this is very important, because we have to follow. We are not undermining any other form of therapy or treatment or form of medicine. But yes, when it comes to cancer, one has to be very, very, very careful about it. Dr. Kanika, you already mentioned that in the previous, I think, a few minutes back. But can you please just elaborate once again something about diet? What to totally avoid, and what can be, for preventing, or for preventing a cancer? What kind of diet should be followed?
So I think it is an important thing to know that your diet should be colorful. It should have rainbows in your plate should be full of rainbows. So what I mean by rainbows is at least 5 to 7 colored fruits and vegetables in your diet. All the colored fruits and vegetables, they have carotenes, antioxidants, which help you fight cancer. जो मैंने शुरू में कहा था ना कि छोटे-छोटे cancer cells body में develop होते रहते हैं, your own body immunity fights. This immunity develops because of these antioxidants, because whatever oxidative injuries happen in our body, they are scavengers. ये वो injuries को हटाते रहते हैं. So incorporate a lot of fruits and vegetables in your diet. Second thing is, instead of carbohydrates, focus more on protein. Proteins are bodybuilders. हमारे immunoglobulins, जो हमारे white blood cells में जो कुछ भी बनता है, they are all protein based. So if you have good amount of proteins, your immunity is higher. lately I came across a study which was on vitamin D. Previously, I used to think vitamin D is all a marketing jinx, it has just been marketed heavily. But there's an authentic study saying people who are deficient in vitamin D versus who have normal levels, they found जिनकी vitamin D deficiency थी उनको 14% ज़्यादा risk था cancer वापस आने का. So your diet should also be full in context of all the vitamins. So preferably सारे vitamin diet से आ जाएं तो अच्छा है, but at some times, as we get old, our digestion is not that good. We might need to supplement it from some external sources. So do not hesitate. Get your vitamin D levels tested well in time, and that can also be supplemented as per your requirement. Then next is roughage. जो बड़ी आंत के कैंसर, जो कोलन के कैंसर होते हैं, that happens more so when your diet is less in roughage, and if you are consuming more red meat. White meat is considered safe, but red meat and diet which has less salad can cause colon cancer. So incorporate lot of salads in your diet. अच्छा, कुछ elderly कहते हैं कि salad नहीं खा पाते हैं. So there's a very good way. You just grate it and maybe puree it, but in some form incorporate the fiber in your diet. Third thing is that you should have adequate amount of nuts also. People underrate nuts, but they also are good source of good fats as well as some amount of fiber also. So the traditional Indian thali, जो जिसके अंदर आपका multiple grains होते थे, fiber होता था, that is the best way. And I think Western world has come to an awakening. They are learning from us. They are learning yoga from us. They're taking our eating habits, and we are aping the West. We are eating pizzas and burgers. So I think pizzas and burgers need to be reduced overall in our country. And we need to look at healthier versions, the versions which are more rich in grains. I think that is one big takeaway. And diet ke alawa, jo maine kaha, tobacco is the biggest culprit. That really needs to be addressed because it is very difficult. Government will never take a step on it because it is associated with a lot of revenues. It is our onus that we do something about it.
Very rightly said. I think that is a very important thing. So diet, whenever we talk of any topic, the factor of diet always comes in. That is actually, a very, very important thing. Anybody else would like to ask any questions? Anyone? I have one more question to ask you, Dr. Kanika, that as we said, and then Brijupta ji also said that he has somebody who already suffered from cancer and he's not cured. And then we have a lot of people who have had undergone some form of therapy treatment for some cancer and are cured. So what advice would you give to them that going forward, what should be their way of life and what regular tests and all should be done for them, generally speaking?
So each cancer has its natural history. कुछ cancers में वापस आने की प्रवृत्ति होती है. So there we want to keep seeing the patient every 3 months for 2 years. And after 2 years, we make it 4 months. After 3 years, we make it 6 months. And after 5 years, once in a year. So on these visits to the hospital, we will examine and see whether we are seeing any signs and symptoms of cancer. We are also looking for the side effects of treatment which we have given. Just breast surgery hoti hai, people develop lymphedema. So we want to see all those factors also. So you have to be visiting your doctor irrespective of that you are cured, because the 5-10% risk always remains. So it is important that your clinical examination and time to time tests, like if somebody is having a higher stage of disease, we will recommend PET CT scans, ultrasounds, X-rays, MRIs based on what the tumor was. These are required. And at the same time, you also want to make it sure, because there's a lot of nutritional deprivation during cancer treatment. Khana pina kam ho jata hai, khane ki ichha nahi karti hai. So we want to ensure that you are walking back towards normalcy. तो वो convalescence भी बहुत important है कि डॉक्टर की supervision में हो, so that you walk down healthily outside. It should not be that lifelong के लिए कुछ problems persist कर जाएं. So it is important to be under a follow-up even after a successful cancer treatment.
Yeah, this is very important because people should not feel that now we are cured, so we need not go back again. So that is very important, that regular follow-up and regular testing and screening should be done.
I wanted to tell a little bit, because you asked me about certain myths. So apart from sugar, there are few other chemicals in which there is a risk of cancer. So one of them is those hair dyes which are ammonia rich. So do not use hair color which are having ammonia, because long term they are known to cause cancer. A study has come this year that women who are using lot of hair straightening chemical agents repeatedly, उनको यूट्रस का कैंसर ज्यादा हो रहा है. तो ये जो केमिकल्स हैं इनको अपनी लाइफ से बाहर निकालना है. Then people ask me about plastics quite a lot, कि प्लास्टिक के बर्तन जो हैं उसमें खाना बनाएं, खाएं, नहीं खाएं. So I think we really need to get plastics out of our life. Try the conventional utensils. Steel जो हमारी families में traditionally चलता था is the best utensil to cook food, because Teflon बर्तनों के जब scratch पड़ते हैं उसके अंदर से जो fumes निकलते हैं उससे भी cancer हो सकता है. So take away all these artificial things. Whatever we are getting from the Western world is always brought in more diseases than more prosperity in our country. So that needs to be taken care of.
I think that's very important you have said, because people do tend to have plastic utensils, and I think glass is something which is quite safe and should be used. So this is also an important thing. And yes, use of ammonia rich hair colors should be avoided. That's very important. So I think we have had a very interesting discussion today, and we have heard quite a lot about how to prevent, how to early diagnose, and how to manage the situation of a cancer. We heard from Mr. Gupta also that how his family has suffered, and Dr. Kanika has actually explained that to do that genetic mapping for the family, which is very, very important, because for the further generations, you can probably find out the risk factors in that. And we also today understood what should be the warning signs and the alarms that should be in our mind, that if some certain things happen, we should go and get ourselves checked up. Anyway, after the age of 50, I think we should all get ourselves regularly screened for different cancers, different common cancers. So thank you all. Thank you for joining today. We hope you people enjoyed today's talk and you had got a lot of information. Please contact us if you need any more help. And Dr. Kanika, thank you very much for joining, and thank you for really cutting short your previous conference and coming to attend to us.
Most welcome. I think as a clinician, I think it is very important for us to prevent.
Yes.
You don't feel very happy sitting in your clinic and feeling sorry that you could not help a person, survive long. You feel more happy that you could save more lives. I think, and talks like this saves more lives, and it's a moral responsibility of each oncologist. So thank you for having me here.
Thank you, everyone. Thank you for joining.